Hello, I'm Joan Justice with HealthWorks Collective, and I'm here today with Kelly Tappenden from the Alliance to Advance Patient Nutrition. The Alliance is the result of the partnership of 5 prestigious healthcare organizations representing more than 100,000 healthcare professionals and has for goal to raise awareness about hospital malnutrition and improve patient outcomes while reducing costs through early nutrition screening, assessment, and intervention. Kelly Tappenden, PhD, RD, is a professor of nutrition and gastrointestinal physiology, and she's editor-in-chief of the Journal of Parenteral and Enteral Nutrition. She's the clinician representative for the Alliance to Advance Patient Nutrition. Kelly, tell us a little bit about the Alliance, how it started, and what its mission is.
Thank you, Joan. I appreciate the opportunity to be here today and tell you about the Alliance because malnutrition is a very big problem in our country, and it's one that we don't often hear about. So I will tell you why it's such a big problem, but first let me tell you the Alliance has been formed to improve the coordinated care of nutrition therapy for patients in the hospital so that we can reduce both the prevalence of malnutrition but also the consequences. We can improve patient outcomes through better nutrition. So one of the reasons that the Alliance is formed is to provide broad education to clinicians about how to understand that malnutrition is a very big problem, but how to recognize it and then how to intervene. Not only is malnutrition a burden on our healthcare system and patients' outcomes, but by using proper coordinated nutrition care, we can really improve those outcomes too.
Mm-hmm. That's okay. That's understandable. Now, what does your research show about malnutrition? Is it you say it's prevalent here in the United States? What are these mostly the elderly?
Well, we know that there is a high incidence of malnutrition among the elderly, but if we look at all adults entering the hospital, 1 in 3 are actually malnourished. 1 in 3 individuals. And that's a problem because an individual who is malnourished is at more risk for complications. So for example, pressure ulcers. If someone has malnutrition or is malnourished, they have a 2-fold increase in the risk of pressure ulcers. The rate of infection goes up 3 times. In fact, their length of stay is actually longer, as well as their readmission rate if they're malnourished. So it certainly is a problem that results in poor patient outcomes, but it also increased costs. And in our current healthcare environment, trying to reduce costs while improving patient outcomes is a very big priority.
Absolutely, absolutely. Now, what steps are you recommending that hospitals take to reduce malnutrition? For instance, I see that you have a toolkit, for example, that you can download from your website.
Yeah. We do have a toolkit, and that can be found by clinicians at malnutrition.com. So clinicians can go there and find all sorts of resources talking about the burden of malnutrition, but also the beneficial impact of nutrition intervention, and then really some strategies that will help them practically implement better nutrition care within their institution. Because we know that providing strong nutrition care to individuals is going to help prevent those complications as well as reduce stay. In fact, getting back to that research, we know that if an individual is to be offered an oral nutrition supplement, a recent study showed that there will be a 6.7% reduction in their risk of readmission. So a simple thing like an oral nutrition supplement can be very important in helping improve these outcomes.
Yeah, that's great. Wow, I didn't know that. Now, what about after discharge? Are these patients followed?
That's one of the things we really feel is important to have a good system in place. And so when a patient is discharged from the hospital, whether it be to home or to another care environment, we really need to have a nutrition care plan that is properly communicated and goes with that patient. So it's extended to the nurse clinicians who may be following up with them via telephone, or the primary care physician. The family's well educated. So there's really 3 things that we want to advocate for: making sure that 100% of patients within the hospital are screened for malnutrition, using a valid screening tool. There's all sorts of screening tools that are in place that can help clinicians easily identify patients at risk for malnutrition and make sure a dietitian gets there to assess their nutrition status. So making sure everyone is considered for this risk. And then not waiting and waiting and waiting. Sometimes nutrition is put off while other medical issues are taken care of. So immediately prescribing that nutrition care and intervening. You know, not only are 1 in 3 individuals malnourished when they enter the hospital, but another healthy chunk of individuals will become malnourished while they're in the hospital. And we can't necessarily let that happen for reasons that we can prevent. So having an immediate nutrition intervention get into place is important. And then, as we were just saying, following them through post-discharge to make sure that their care once they get out of the hospital is critically important.
Yeah, great. Thanks so much, Kelly. I'm so glad that you could share this information with our readers, and we look forward to hearing more about the Alliance to Advance Patient Nutrition. Thanks so much.
Thank you very much.